Assalamu alaikum, the communication day. The sitting in a quiet relative's room in the hospital. The participant, you are the doctor in the ICU, and Mr. Hassan, the father of Miss Mona, 24 years old. The background, Mona took a large dose of paracetamol in an overdose since 3 days. Her liver function tests are very high. Despite antidote treatment and acetylcysteine, she is now having acute liver failure with metabolic acidosis, and the hepatology team anticipates urgent liver transplantation. Mona requested that you will not disclose the overdose to her father. Please sit with her and address her the father concern. Okay, ready, Dr. Maida?
Yeah. Hello, my name is Dr. Maida, one of the medical doctors here in the ICU. Can I confirm that you are Mr. Hassan, Mona's father?
Yes, doctor. I am Hassan.
Uh, Thank you for sitting with me. I want you to update you about Mona's condition. Beforehand, can you tell me further what do you know about her condition?
Really, doctor, I don't know anything. I live in another country, far away from my daughter. I visited here yesterday, and her neighbor told me that she is in the hospital. I come today in the hospital. I wanted to see her. They said that I can't visit her. I don't know why. So I wanted to know what happened to my daughter.
I'm so sorry for that. It sounds very difficult for you. Miss Hassan, Miss Muna, she's very unwell at the moment. That's why she need to be in the ICU, in the intensive care unit because of her condition. I will gonna discuss with you her condition. That her liver has been very severely damaged, and despite all the treatment we have given up to now, she's not recovered.
What you tell me, doctor? His liver damage? Why, doctor? She is too young. So why liver damage?
Yeah, it's a little bit difficult to say that, but her condition, what we are calling in medicine, is acute liver failure. That means it doesn't necessarily she has previous illness, and this condition has happened suddenly. And I'm afraid to tell you that it is a threatening her life.
So it is cancer, doctor? What is the cause, doctor?
Okay, so the cause at the moment, this type of damages happen to the liver. Most probably, there is exposure to some toxins or any harmful condition causing the liver to fail. And at the moment, she has been assessed by the liver specialist team, and they believe that she may need urgent.
Sorry, doctor. Sorry. You told me that she exposed to substance. What type of substance? She live in the capital, in big country. So what kind of substance? She live with her husband. So is his husband try to harm her, or because she drink alcohol?
To be honest, it's not like we didn't have information that her husband tried to do anything with her, and we spoke to Miss Mona regarding what has happened, but Mona has asked me specifically to not share some details of her condition and how this happened, and it's my duty as a doctor, as she and to respect her wishes as adult. And at the moment, I'm telling you that her condition, what is the current condition is. But if Miss Muna allowed me, or she want to tell you the details herself, this will be more helpful. It's
Doctor, what you are talking? I am here, father. So what you are talking? I wanted to know the cause. Is due to alcohol or due to cancer, or what kind of what kind of liver damage that she has? She is the liver, doctor.
okay. As I told you, I know
It
that
is
her
it is
penetration.
the liver. You don't tell me that she has sutured or anything, but
Mhm.
you tell me that the liver damage, and you don't want to tell me the cause.
Mhm.
It is nothing, doctor. Where is the consultant, doctor? I need to meet the consultant. If you can't tell me the cause, okay, no problem. Please arrange with your consultant. I think
I-
he is able to tell me. I think, doctor, you don't know the cause of her liver.
mhm.
Sorry, the liver damage. I think is that, doctor.
I highly appreciate your anger. I can understand your frustration, and everyone in your place may react similar. I know it's not an easy that a father come to visit his daughter and find her on the ICU with these damages has happened. But
Mm-hmm.
as a doctors as well, we need to not break our patient's confidentiality until she give us the permission to do so. Uh, but I'm sharing with you her medical condition at the moment. This is the main issue at the moment, that her liver is failing and it's not anymore working well. And that's why we need to just make sure that we are doing the best of as possible as we can and treat her probably, and this through the transplant. And also, you have the right to meet my consultant, and I can arrange this with the consultant to meet you as well.
Mm-hmm.
But
Okay, doctor. Thank
yeah,
you. So what is the condition now?
okay. So her condition now is, as I told you, is not stable, and this is because the liver is very important organ in our body to,
Mm-hmm.
and now it's really damaged. So we may need to we consult already the liver doctors, and they think that it's important to she may need to transplant if her condition deteriorated further.
Mm-hmm. Okay, doctor. So he might need the liver transplant.
Yeah, yeah.
Mm-hmm. Okay.
So, as I told you, it's not an easy information to tell, to be honest.
Mm-hmm.
And I know this is hard to say and hard to feel at the parents. But as I told you, we have a duty of keeping the confidential information, and we hope at a point Miss Mona can told you her story by herself.
But please, doctor, tell me it is cancer, doctor.
Uh, no, we don't think it is a cancer. We
It
don't
is
think.
due to taking illicit drug because she take party drugs more. You
Uh,
think? Mm.
okay, so as I told you, at the moment we can't disclose what has happened until we have agreed with her, and when she is agreeing to tell the cause, I will be more than happy to deliver this for you while she's a work. If her condition deteriorate further and she lost her capacity at that time, we need to have another meeting to assess her best of interest with you and the family.
2 minutes left.
How this sound for you?
Okay, doctor. Okay, okay. So what is the plan now with my daughter?
Okay, so as I told you, we are arranging the liver transplantation for her,
Mm.
and this is not an easy operation, and things can happen in between. So first we need to there is a complication of this surgery, as well as it is a surgery, obviously. uh, she can bleed. That means she may lose some blood as well from the surgery, but we try to make sure that there is already blood to give her at that time. And also the other thing that she may have infection, and this type of infection obviously we try to cover with antibiotics, but if the infection is still there, it can be more dangerous as well. Also because of the liver issues, that's the liver, the organ that get rid of the toxins of our body. And it's fall at the moment. This toxin may go to the brain and cause her to be disoriented, what we call encephalopathy in the medical term. We'll keep you updated about her condition as far as we
Okay.
know. Is that okay?
Not okay, doctor. Till now, I don't know what happened to my daughter. I don't know what will be done to my daughter. So it is not good, doctor, really.
Okay, I will arrange another meeting with my consultant, and I will give you some leaflet and brochure and website to read about liver, acute liver failure, your daughter condition at the moment. And if you raise any raise any concerns or anything, you can discuss further with my consultant and with the liver transplant team.
Yes, doctor, I have a concern. Sorry.
Okay.
Okay. Sorry,
That's
Dr. Bassem.
concern. Okay.
No, this is the concern. Okay, first concern. Is my daughter going to die, doctor?
This condition put her in a critical position as far as she's on ICU. Obviously, she's in a critical position, but things can go either way. And we think liver transplant will be of her best of interest. And we hope the condition go in the right direction as we hope.
So, doctor, if she need the liver transplant, what about the donor?
Normally, we have in the liver transplant center, there is some, we have this graft or this liver part
Okay,
of.
so it is available in your center, doctor?
Yeah, most of the time there is, we have some livers, and this because it not need to donate with all the organ, just a part of the organs, and this all the things will be arranged by the liver transplant team. And as we are here in the UK, mostly you don't need to do anything about it. We arrange all this by our centers.
Okay, doctor. Thank you.
Okay. I know this hard condition, this hard information to be given at the moment. So I can arrange also a meeting for some support for you and the family. I mean, if you need any support at this time of to go through this part of time. I mean, support psychologically and someone to talk to you so they can relieve your worries and these things. Is that okay?
Okay, doctor. Thank you very much. Thank you.
Okay. We added some times just to address all the concern in this scenario. Dr. Mahmoud, now you can comment.
Okay, really, Dr. Bassem, Dr. Maida did it well. I want to listen it from Dr. Maida because this scenario came last night in Jordan, but it was, I think, a patient with on alcohol, and he now had fits yesterday, and today he asked to the doctor not to tell the mother the cause of fits. So I think that's the same scenario. Okay, I came this scenario to know really what I will do in this scenario because I don't know. But I listened from a mentor. He said that about first it is breaking bad news really, I have some not good news for you. What happened? I think your daughter had been a condition called liver failure, which is a condition in which the liver can't work in the proper way. So the father will tell, okay, doctor, what is the cause of liver failure? So the answer will be there are many causes of liver failure. Sometimes we know the cause, and sometimes we don't find the cause. So the father will tell, okay, doctor, what is the cause in my daughter? I will tell that we have to keep confidentiality of Mrs. Mona. She tell us some information, so we have to keep the privacy of Mrs. Mona. The father will be angry. Okay, doctor, I am here, father. How to talk with me like that? So my answer, okay, I know the situation now is difficult. So if you can sit with your daughter. It is your daughter, and speak to her. If she tell you, it is no problem. Now يعني in the corner the father, okay, sit with your daughter, no problem. If you tell, okay, and after that, the process of liver transplant. I think even in UK, the liver donor is not option. So what we are going to do, we will involve the organ, the, the transplant team. They will go on the process of transplant if she need, because till now she don't need liver transplant. So in our team, it is the transplant team. They will care here, monitor here, and if she need any liver transplant, we will begin the process of finding suitable donor. Just that. What is the condition now, doctor? The condition now is critical. We have the liver not work properly. There is also what we call the increase the acidity of the blood. They can cause breathing problem, may cause heart problem. So we have to give her fluid, give her suitable treatment. If her blood pressure going low, we will support the blood pressure. We will support his breathing. Just that scenario I know. If anyone has any other options, please tell me.
No, no.
Very nice. Good.
Yeah, thank you, Dr. Mahmoud.
Thank
The
you,
same
Dr.
idea, as you said, the concept, the same of the epilepsy patient who has injected or shared medication or illicit drugs with his friends, and he
Yes,
doesn't want his mother to know about this. So
yes.
it's a matter of confidentiality. Yes, till the age of 16, the patient has his privacy, and the confidentiality should be maintained in this scenario.
Yes.
Whenever she asked you, you
I
have
think,
to.
yes, I think in this scenario, Dr. Bassem, the scenario of Fitz, the mother
Yeah,
will tell the doctor, doctor, is the alcohol or illicit drugs
yeah,
he taken is the cause? So the answer will be to يعني distract here. Okay, what
distracts. Yes,
distract here? Okay,
yeah.
what do you think? Is he drink alcohol more? Is he take illicit drug more? The mother will be يعني will be little angry.
No worry, whatever, she will
Mhm.
be angry, but you have to get your marks. Because whenever you
Yes.
breach the confidentiality, you will lose the mark.
Mhm.
Definitely, they will, maybe they will fail you in the scenario. So you have to maintain the confidentiality, whatever the situation. If she
Yes.
knows it's okay, she has to sit with her or to sit with him, or the father sit with her to have a talk. And if she told him, this is their issue, not our issue. But as long as the daughter asked us not to share, so we have not to share. Okay. But I preferred also to add initially next of kin. Even if he is the next of kin, we will not tell
Yeah.
him. But yeah, for just for the confidentiality, more to be more confidential. You are sitting with the one who should know also the liver failure. Okay. So you
Mm.
have to ask initially also about the next
Next
of
of
kin
kin.
earlier,
Yeah.
yeah, because she has her husband, and maybe the husband is the next of kin, and also she might be not to be informed the father about the acute liver failure. So
Mm.
you have to confirm This is very sensitive situation. The daughter has some social issue with her husband, with her father. She's living away, and we don't know what's ongoing with them. So the best way is to first to assure that he is the next of kin. You cannot say here confidentiality for the father. No, if you want to say initially, there is some confidentiality in this meeting related to your daughter. So please be informed that we will sit with you and discuss what we can discuss with you. So at as early expectation from the father that there is something ongoing and the doctor will not share it with you or with the father. Okay. Or you can tell it later on. I'm sorry, as you said, it's a matter of confidentiality. You can sit with your daughter after this meeting, and if she has the right to tell you what's ongoing. From our side, we just tell you about the medical condition, and in her situation, in the best interest, we give her a medication. You have to talk, Dr. Maida, use every word in the scenario. So in anesthesia given, in anesthesia staying given, so you can tell him, we give her a medication in the best interest of her condition called N-acetylcysteine, a substance given through the blood channel to to improve or to protect the rest of the liver from damage. And the other thing, our team, expecting that she might need to be transplanted with another liver. Now you can talk about the transplant as a surgery and the possible complication. Again, you have to reassure him that the consent form will be signed from the daughter. In another meeting, we will discuss the surgery if it will be decided by our team. The complication, everything will be discussed in another meeting. If he insists to know what happened and what she ingested, what she took, and he's expecting, okay, after having a chat with your daughter, if she has informed you about what's ongoing, okay, we can arrange a meeting. If he insists to know from you, tell him again, this is the confidentiality of the patient. And if he insists to meet a consultant, it's okay, this is his right. However, this will not change the situation because, again, we are here to maintain the confidentiality as long as she is aware about her condition and she is requesting that. Anytime she lost the capacity or she is unable to take a decision, this is the time we can talk to you as a next of kin and to discuss about everything in details. And Dr. Maida, I think she said this in one sentence, which is perfect. So we have to talk about this part in the future. We don't know what will happen, but if he or she lost the capacity, we might raise this issue with you, and we'll tell you about the details. Okay, let's talk about concern one by one. Yeah, was it because of cancer? Here you can say, no, it's not a cancer because this is a medical condition. And this is a medical part of the scenario. No, it's not a cancer. It's related to something else. What is it? Yeah, you can say it's related to some damage related to the toxin. And don't say what about this toxin. Was it received? What is it taken by mistake? You don't know the details about the ingestion. But there is, yes, some toxins harm the liver, and more details we cannot tell you. This damage happened, and we are going to discuss about the further management, as we said. Okay, is it alcohol? You can deny that because it's not related to alcohol. However, we don't know about her alcohol state yet because you don't know the history. It's not written. He might tell you, yes, she is taking alcohol in overdose or whatever. Okay, again, this is her confidentiality. Again, I cannot tell you about more details. Need to meet your consultant. Okay, it's your right. You can meet anyone. This is your right to meet the consultant. What is the condition now? The condition is very critical, threaten her life, and some patients might end up with coma and the liver totally damaged. Unfortunately, they might sedate or it might reach up to death. Need to know more about the surgery? Okay, this is his right as a part, a medical part. of the management plan. It's surgical part, but I mean it's not confidential. So he will know the steps and the progress. If the liver available or the donor available, it will be arranged in case we decided for that. We will update you in another meeting, either from a live donor or from the cadaveric donor. I guess the liver transplant will be from cadaveric one, so the transplant team will arrange the liver. Unless they don't have, they might take a loop from live donor. Okay. Again, it's a future plan. It will be discussed later on. It's not the time to discuss it in this meeting. Although no decision yet. So it's anticipated, but still not yet decided. If they decided, this is the time to talk about all, and the consent will be signed from the daughter. Okay. Any question, Dr. Maida or Dr. Mahmoud?
Yes, doctor, I have question. If the patient lost the capacity,
Yes.
and yes, and before losing capacity, she told me also not to tell my father. So I will tell I will tell the father if she lost the capacity.
Yes. You don't know what will happen, what expected will happen in the future. And she lost the capacity. She might be in coma, and this coma will end up with death. You don't know. And
But we
might be
have
the explanation to the father will help her by arranging. He may be the live donor for her, right? So as long as she lost the capacity, this is the time to speak and to open up. This is my opinion, even if she requested. But now she is not with us. She lost the capacity. Okay.
okay, Dr. Bess. But I think we should respect her wish.
Okay then.
I don't know. Just
Okay, let's hear the comments and shares from others. Anyone has background or experience with such scenario? Dr. Maida
Yes,
also there. Yes, Dr. Ala?
yes, Dr. Basim. I think that any wish that being expressed by the patient should be respected at any time. And
Till the
also, we
death.
are asking till that, yeah, and we are also requesting from them to express wishes to comment.
To respect it, yes.
Yeah, because also in the condition of losing capacity, that we know their wishes to apply them.
Yeah, by the way, this is for the medical plan, not as informations. You got it? Not as pathology. It's about, I mean, the advanced directive and the wishes regarding the medical plan. I should be treated with this. I shouldn't be treated with this. I don't need CPR.
As,
So,
as if this information it will not be harmful to anyone or not. It
so
will
what
yes,
do you
not.
think?
because
What harm will happen more than the coma and death?
No, no. I mean
because
to the others, not to her. As this information will not be
yes,
harmful to the others, will not affect the others. So there is no need to disclose the information because it will not affect the others in any way. The most important now that is the situation she is on, which is acute liver failure and the management of the acute liver failure. Even
yes.
during the transplantation, I think even this information will not affect the decision regarding the donor. If the father will be the live donor for her,
Yes.
it will not affect his decision also.
Because
Okay.
you know, Dr. Bassem, sorry,
Yes.
this,
Yeah, yeah.
this scenario, this scenario of liver transplant, the main scenario that the patient lost of her consciousness, and before losing her consciousness, she tell you that not tell the father. That is the main scenario. Really,
You are making
really.
the thing complicated.
No. That is really that is
It's really doubtful one. Really,
Yeah,
it's doubtful one. I don't know. This is my opinion. Okay, we can hear
yeah,
more.
I think you're right. Yeah, it's still we need to not break the confidentiality because when she has capacity, she told not to tell. So still we respect
Okay, let's make
unless
it
unless the transplant team want to
to know more.
disclosure or to know
Yeah.
more deeper or anything. This is the
Okay.
transplant team at that time. But I prefer like if this has happened, we may have another discussion. Just let it open. So Just
Okay,
open.
let's make it more complicated. How do you decided about her capacity if she's already taken this medication? She might be also lost the capacity even while she's saying you or she's saying to you, please don't, or requesting you not to share this information.
Yes, in the
Because
scenario Dr. Basim written before losing of consciousness, patient tells that not tell my father. That is the main scenario, but I forget to write in the scenario.
Okay.
Mhm.
I didn't hear this scenario from any mentor before or any experience. And anyone with feedback from Jordan, please, maybe someone will hear this record. If he had this scenario and he had the feedback about the discussion, please share it immediately either to the YouTube comment or even the group here, the WhatsApp group, or even me privately. So this is a call, urgent call, announcement for feedback.
uh,
I,
all
I
the
think
men.
Dr. Basim, according, I don't know the name of doctor, sorry, she told that it will be the decision of the transplantation team. I think this is
Dr. Maida.
more
Yeah,
logic.
Dr. Maida.
This is more logic. Yes, this is more logic because before in many scenarios, if the patient lost the capacity, the decision will be even if she refused any medical decision after losing capacity, if she didn't has any advance directive or wishing wills before losing her capacity, all decision will be in the
Respected.
by the team, will be by the team. I think if she is refusing certain procedures, this is what I know before. That
This is regarding, Dr. Marwa, thank you for this sharing. But I think this is regarding the medical management plan, medical part. We are talking about the pathophysiology or the main cause of hair deterioration and her kidney or her liver failure, which is suicide attempt, honestly, right? And she doesn't want anyone to know about this suicide attempt. This is the question. Will you inform if he insists to know? Was it before because of the suicide attempt, or was it accidentally, or was it by mistake? This is
I
the
think
question.
we will respect her wish. We will not disclose the information. But as Dr. Maida said, if this is, it will be in, if she needs another procedures, and we need to know more information before going to the procedure like liver transplantation. I think the team, I think
You know why? Yes,
can.
because you have to disclose this to the transplant team. They will ask why the liver is damaged, and this time you will breach the confidentiality because of suicidal attempt, whatever the situation, right? Either the liver damaged or the hepatotoxic effect happened. So they have to know because of what and how much. I think all this information will be disclosed to the transplanted team. I don't know if is it the time also to tell the father as a next of kin, not as everyone, as a next of kin. This is my opinion. So he should know that because of the suicide attempt. Why also in the future, if she recovered, she might need to be observed, right? And he should know about the situation. I'm talking about after she lost the capacity. Definitely, you will not do anything as long as she is awake and oriented and she can take decision on behalf of herself. Clear now for all? Yes, still there is debate. Anyone want to share? It's okay. It's a matter of sharing and discussing. Anyone
Uh,
wants? Yeah.
yes, Dr. Basim, because also one mentor told me before it's better not to tell the father that the daughter requested that this information to not be disclosed. I don't know, this is like accurate and
Yeah, it makes
advice
it,
on.
yeah, it makes it more suspect or suspicious as you make him more suspicious. Yeah, you want to get to tell him or give him idea that yeah, there is something ongoing.
Yeah,
But
I mean, but that's the true. We should convey the true. We should convey that she has, as you have mentioned also, there is some confidential information
yeah,
that we
but not
cannot
as
disclose with you.
direct. Yeah.
Okay.
You want to say it's not as direct talk or frankly. No,
Okay.
I will not tell you because of her confidentiality. Yes, yes, you have to try to deviate him from this question and don't give him this answer as direct answer. You can also appreciate and blah blah blah. I
Mm.
agree. Why? Because once you do so, he will be more angry. What you are saying? I am the father. Why you are saying this to me and blah blah. So the best way is try to deviate, and if he repeat the question with insisting, okay, now the time to say I'm so sorry. It's a matter of confidentiality, and here we are discussing this issue with the patient himself. So don't say the daughter requested not to tell the father. Yeah, it's, I think,
Mm.
makes it more angry.
Okay.
You got it, Dr. Ala. I agree with you
Yeah.
in this part, but I think also Dr. Maida agree for that because she did the opposite. She said requested by the daughter. So in order not to have an angry father, better to say it's some personal and some confidential information related to the patient herself, and we are here. Our role as doctor, this is our duty as well, to maintain the confidentiality for every patient in the hospital.
It will put me in a danger in if this patient died, and I didn't tell the fathers. Frankly, she is
Mhm.
she didn't want to share this information with him. If she died, he will sue me that I keep this information from him. So he need to know that I'm keeping this because I need to keep the confidentiality.
Yeah,
If
anyway, you are
anything
keeping and
happen,
maintaining it, but without saying your daughter, the one requested that. This is our duty.
because if the daughter now losing capacity, or even she has capacity, if she has capacity it's easier, but if she lost capacity and things go to the other direction, and I am not telling the father that exactly the daughter she didn't need that, I will not break the confidentiality of her. He may ask, if anything happen, why you keep this information from me? It will be in the future problem. So
Yeah,
it's
I got it. Yeah,
fair.
but
Yeah, it's just make fair, and this is the right of everyone to keep things from others. So it's even if he get angry, now I am. The important part is my patient, my
yes,
patient.
I agree with you. But anyway, we are doing so even without the patient request, right? Some personal information. This is the patient right. If he already hide it, we will not share it with the father or even with the next of kin if no permission. That's why we are assuming there is a permission. But in this scenario, you got an idea there is no permission. There is something she want to hide and she doesn't want anyone to know about it. So this is the time to say it's confidentiality. Okay. If he insisted more, if you know, if he asked more, please, doctor, why you are hiding or why you are saying this? She's my daughter. I am the one. If he insisted and asked many times, so you can say it, but not as first time as first answer. She requested not to say that. So at least respect that he's the father, and he will not be angry whenever you start to prepare him in this way. But from the first moment, if you tell him, no, I'm so sorry, I will not tell you because she's requested not to tell anyone, even you, he will be more angry. So avoid this by the other deviation and tell it or tell the information confidential. And sometimes we maintain the confidentiality according to the patient need and required. Okay. Anyway, it's a approach and everyone can manipulate and do whatever he's feeling this one makes sense for him. Always feel and follow your sense. And what I feel now and my sense now is the opinion that I said. Yeah, as Dr. Ala also confirmed, no need to say she requested. Okay, this is our job. Although we are sharing with you everything, but there is part in her history and in her life I'm so sorry. This is her confidentiality that we will not share it with anyone unless she accepted that or unless she is lost the capacity. Okay, it's a really challenging scenario.
Yeah, it is.
Thank you,
It is
Dr.
challenging.
Mahmoud.
It's
Yeah,
hard
but
scenario, Dr.
Yeah.
yeah,
So the
but
concern, I think, one of the concerns raised by the father that you know the cause. Did you know the cause of her?
Yes.
Did you know
so
the cause? So if
yeah,
I am
good.
I'm manipulating the facts, it sounds like I don't know the cause.
Yes, you're right. If you
Mm.
said we are still confirming, means you said something is not the truth.
Mm.
So, what do you think the best way to answer this?
From the start. That's why from the start I will be direct. I will keep some information because I can't break the confidentiality
Yeah,
from
yeah,
the start. Yeah.
yeah. Don't play with the words and look like you are telling a liar to the patient. So, better to say we have know the cause, and I'm so sorry to say this is one of the confidential information we shouldn't and we cannot share with others. Do you know the cause? Yes, because you have already the drug level, paracetamol toxicity, along with the clinical finding, the acidosis, along with the liver function test, and the other function test that showed the liver is damaged. So we know, however, I'm so sorry and afraid to say it's one of the confidential parts of our information. We cannot share it with anyone. Clear, Dr. Mahmoud?
Yes, clear, Dr. Bassem. Yes.
Okay. So don't put yourself in a trouble regarding the issue of confidentiality. I think capacity will be lost whenever the patient is comatose, and you can only disclose this information to the next of kin. This is my opinion. If you are respecting or you are saying, as Dr. Marwa and Dr. Maida opinion, so I will never disclose unless there is, for example, advice from the transplant team that I should know the disclose the situation. So you can do it as diplomatic way. So you didn't do it by yourself. You just throw it to another team who will disclose this information to the patient. You get it? So you will not lose at least the full mark if it is something accepted. So it will be disclosed not by you. It will be after the transplant approval. You can throw it to the another person, or you can throw it to the consultant. We can ask the consultant regarding this because it's very difficult to tell about it right now. What do you think about the consultant? It's a good thing to throw everything to consultant. Dr. Mahmoud,
Yes, Dr. Bassem.
is it good idea to say the consultant will
But I don't know because I don't
still
know.
you are you want not to inform and not to disclose, right?
Yes, Dr. Bassem. Yes.
Even after consultant. Okay, but if you say that, it will not harm. If you will say to the father, I will ask my senior or my consultant if I can do so after she lost the capacity. What the harm? You didn't do it. At least you didn't disclose it, and you are here in conflict. Should I do or not? You didn't do.
Mm,
Definitely, you will keep your mark and you will save your mark. And at the same time, you didn't also breach the confidentiality. Okay.
mm,
You false hope that maybe I will disclose this for you.
No, no, no. I didn't say I maybe. I said I can ask the consultant regarding this. I didn't say yes, and I
Uh,
didn't say no. So the decision now will be on the
uh,
consultant based on his decision. I don't know also if he will accept or no. This is his decision because this matter maybe at higher level than me, and I cannot take decision on this.
Sorry,
mhm.
Dr. Basim.
Yes.
What if the patient age less than 16? We can disclose the information or?
Yes. Good question. Yes, you can do everything.
Yeah.
No capacity
Okay.
here, no confidentiality. but they will not bring scenario with less than 16. This is the trick of the scenario, to bring a scenario with a confidentiality. Young one,
Mm.
yeah, he's not taking good decisions because he's still in the teenager age. And the same time, he has the confidentiality, so they can do everything, and he can even inject himself. He can share needles, and when he will be at the medical trapped, he will tell you, please don't inform, and unfortunately you are following him. You are following him. You cannot breach the confidentiality. Why? Because he had the decision now to even harm himself with this drugs or whatever he's doing. This is the
Mm.
rule outside, but here everything you can disclose from the start. Even the whole hospital will know about the case. Yeah,
Really.
there is some confidentiality. I
So
agree.
so less than 16, it's not
Yeah.
the family they can know all the information.
Exactly. The same idea and the same concept. Whenever you want to do the genetic testing, and the mother will tell you, please do the genetic testing for my daughter. And you are saying what? After the age of 16, they will take decision either to proceed or no. Okay, so you will not do it because it will not change the decision, and at the same time he will have the decision whenever he's taking he's being adult. He will decide by his own either to proceed with for the genetic testing or no. Okay, Dr. Ala.
Okay, Dr. Basim, thank you.
Okay, anyone has sharing information, experience? Anyone has a background about this issue, about this debate? Okay, Dr. Mahmoud, your scenario a little bit long. Mrs. So, an 82 years old frail lady was admitted from the nursing home with diarrhea. On arrival, she was dehydrated with acute kidney injury, AKI stage 3, and hyponatremia. Despite resuscitation, she hasn't improved and has since developed hospital-acquired pneumonia requiring high-flow oxygen therapy. The ICU team, again the ICU, has reviewed her and advised she is not a candidate for level 3 care or intubation. The continuous positive airway pressure (CPAP) was considered, but her level of consciousness is now deteriorating. You are asked to speak with her daughter, Mrs. Allison, to explain her current condition and to discuss end of life care planning. The good thing she gave you the task at the end.
Discussing. Okay.
Okay, 2 minutes they can start. Can someone share the previous scenario, please? Yes, it's a good scenario. Please save this scenario with you. You don't know what will happen in the future. You might face this scenario. And try to review and listen to the records. This is very important to know about. Whenever you are in a situation you cannot take a decision, please don't say and don't decide by yourself. Have an opinion from expert person, either consultant or senior, or another team if you want to ask another team, for example. But if you are sure about the information, answer it. Any doubts? Please don't give a clear answer. Try to deviate to another way by referring it to the consultant or the senior with you. Clear for all? Whenever you are ready, Dr. Mahmoud, let us know to start.
It's read Dr. Basim.
Ready?
Mhm.
Okay,
You know, Dr. Basim, just before the session, about 1 hour, I sent to Ala, I said to him, I wanted to practice this scenario.
Good.
Really, but
I
really.
read,
Thank
Yeah.
you.
What I
read,
know,
read your
Dr.
mind.
Yes,
Yeah,
because it is the first time to practice end of life
it's
care.
really good to do. The
Yes.
end of life care. Sorry, I thought about the, yeah. Okay, good to practice the end of life care, and good
Yes.
also to have a paracetamol in a different way.
Yes.
Because usually you are doing the paracetamol as mental capacity and patient want to discharge by mistake or not by mistake, suicidal attempt. But this time it's totally different, which is good idea also to be discussed as a new scenario. I don't know. I didn't hear about this scenario before. You might be facing this scenario. It might be coming again the next diets. So at least we hear about it, and you can do according to your sense based on this discussion. Okay, clear? Let's start the second scenario, please, Dr. Mahmoud. Ready?
Yes, right, Dr.
Yeah, here you go.
Okay. Okay. Good evening. I'm Dr. Mahmoud, doctor in the critical care unit. Today, let me confirm you are Mrs. Suzanne, the daughter of Mrs. Sui,
Yeah, I'm
82
Ellison.
years old.
I'm Ellison, doctor.
Yes, Mrs. Ellison.
Yeah.
Sorry. Mrs. Ellison, you are here to discuss about your mother condition. And I also update you about her condition. Is it okay with you?
Yeah.
Are you the next of kin?
Yeah.
Okay, Mrs. Allison, can I know how much you know about your mother condition?
I receive a call from her nursing home that she did not get well, and she has this diarrhea for several days now. And they sent her to the hospital. I came to see her, but she doesn't look well. I'm really worried about her. Can you tell me what's going on?
Yes, I'd appreciate about your words, Mrs. Allison. Ms. Allison, do you have any expectation? Do you expect anything?
I can see her. She's not looking well.
Okay, Mrs. Allison, let me explain to you the whole condition of your mother. Okay.
Yeah, please.
Okay, your mother, as you mentioned, has been admitted due to loose motion and also dehydration that cause a condition called kidney shutdown, in which the kidney are not able to perform his function in a proper way, and also that lead to decrease some salts in the blood. It's called the sodium. Unfortunately, and we give her some fluid and give her medication in the best interest of her condition. But I'm sorry to you that it is not improved till now. Till now, do you have any concern, Mrs. Allison?
Yeah. Just I want to see what was the next step. What we're gonna do.
Okay, Ms. Allison, I do understand your worries, but to be honest with you, she developed another condition. She has a bug infection in her lung because it is a viral, and also she have her defense system is weakened. So even a simple bug can cause severe bad effect to her health.
Oh
So,
dear.
okay, how does it sound with you?
Yeah, it's frightening me.
Yes, Miss Allison, I do understand that, and also I can see how your mother is precious for you. And because of this bug infection in her lung, her oxygen going low. We put here some oxygen to support her breathing. And in such condition, we assess here, and she reviewed by the critical care team. And as you know, in such condition, when the oxygen going low, we admit to the critical care unit and putting a tube inside here air pipe and connect this tube to a machine. It's called the breathing machine to support her breathing. But this machine also had a lot of bad effect. Sometimes it can cause injury to air pipe. Sometimes it cause bleeding inside the lung. So critical care unit reviewed your mother condition in the ward, and they recommend or advised that she will not have any benefit from admission in the critical care unit, and also she will have a lot of bad effect from this breathing machine without any benefit. How does it sound with you?
Yeah, so I can understand that. I can understand. I don't need her to be in this machine, to be honest. But if there is any possibility, anything else can be done for her.
Yes, I do understand your concern, Mrs. Allison. In such conditions, the treating team, which is the critical care team, recommended to use another type of invasive procedure. Invasive technique. It is a tight mask, which is put in her face to support his breathing. They act by giving oxygen in high pressure. This machine is called continuous positive airway pressure.
Sorry, doctor, there is a lot of medical information going here.
Sorry,
You said
anything?
that invasive machine. I couldn't get that. What do you mean by that?
It is non-invasive. It means that we can support her breathing by a mask from outside, from her face. It is okay. Let me draw to you. That is the face of your mother. We will put a tight mask, in her face. This mask will give oxygen in a high pressure. But unfortunately, Mrs. Allison, this machine, which is continuous positive airway pressure, had a lot of had some circumstances when any patient decrease his conscious level. We can't put this tight mask.
So, why do you mean that my mom lost her conscious level?
I am sorry. I do understand your concern, Mrs. Allison, but I'm sorry to tell you that your mother condition is so advanced, and it is in critical condition. But we are here to support her and give her.
Oh my God! Do you think she's gonna die?
Mrs. Allison, no one can predict the death, but I am sorry to tell you that your mother condition is so advanced. We are talking in a matter of hours rather than days.
Oh my gosh! So
I
I
am
lose
sorry.
my mom.
I am
She's only my family. She's my family.
I
I
am
will lose
sorry.
her as well.
I am sorry for that, Mrs. Allison. Do you want tissue?
Yes.
Okay. So, do you want water?
Yeah. Thank you, doctor.
I'm sorry for that, Mrs. Allison. I know now the situation is very difficult for you. But do you want me to continue, or you want me to postpone this meeting, or you want me to continue?
As you're saying, it doesn't sound like we have a lot of time. So, doctor, we give her. I understand that she has this diarrhea and everything, and you are giving fluid. If there is any hope.
I am sorry to tell you that, and also I'm sorry to tell you that it is no hope. Your mother condition is critical and so advanced. I am sorry for that, Mrs. Allison.
Oh, this is bad to hear. I never suspect to lose her like that. We are planning a journey next week, and we were happy together. Okay, doctor.
1 minute left.
I am really sorry for that, Mrs. Allison. I know how much your mother is precious for you. But as you know, no one, all of us are going to die. But when we die, we have to be in a good shape, with preserved our dignity. So what we are going to do now, we will give her a painkiller to keep her pain-free all the time. We will be assured about that. Um, I am sorry for that, Mrs. Allison. Mrs. Allison, do you have any concern?
Yeah, if you give her painkiller, it will be fine.
Mm,
Yeah,
mm.
please, I don't need her to be in pain.
Sure, Mrs. Allison. Be sure about that. We will give her painkiller. We have the pain management team. They will give her painkiller to be pain-free all the time, and to die in peace, and to die in good dignity shape.
This is really hard. This is really hard. I
I
never
am really,
thought that at
I,
all.
I am really sorry that I am the one telling you this news. But if you want to see your mother, it is a good time to see her.
Yeah, surely. I want to say
It is the
goodbye
time.
to her.
Sorry about that, Mrs. Allison. Mrs. Allison, if you want any support, anyone to drive you to home, no problem. We have here team to support you and to support your family.
No, I don't think that it will go. I want to stay with her. Is that okay?
Yes, Mrs. Allison, it is a time to see your mother now. Please, if you want any kind of support, please contact us. Also, I will give you the telephone of our department. If you need any kind of support, we are here to support you and you support your family.
Okay, doctor. Thank you. Thank you very much.
Thank
Okay,
you, Ms. Anas.
time is up. Well done, Dr. Mahmoud. Dr. Very well done, Dr. Maida. Can you comment? Are you able to comment?
I was going to cry with Dr. Maida, really,
Yeah,
Dr. Maida.
she is crying.
Really, I was going to cry.
Are you able to comment, Dr. Maida?
Yeah. Very
Okay.
good, Dr. Mahmoud. So just comment on the treatment. I think you took a lot of time to explain the treatment. I mean the ICU. As far as she will not be for that, I think it will be a good idea if just we don't need to put her. The ICU team saw her and they think putting tube on her. It will be very difficult given her being frail, and she will not tolerate that, and it will be difficult to win her from that machine. Stop here, go to the CPAP. You don't need also to give the CPAP. So you can try, we put her in a machine, can help her breathing with pushing the air inside her air, but she didn't tolerate that, obviously. Now we need to focus, because you didn't tell about the end of life care. You didn't tell. So the end of life care, that means we will stop all the, now we need to shift. As far as the medication is not helping her at the moment, we need to shift our care for her to make sure that she's comfortable at the at her end of life. And this is type of treatment we are giving to help people to pass in peace. So what we're gonna do, we'll stop all the medication, we'll no further injecting her, we'll no further taking her vital. This is the signs that we know how is the patient doing. We just focus in keeping him comfy and peacefully, so the nurse will not check her vitals. We will not give her any injections. We will consult the palliative team care to come to see her to make sure that she's pain-free. we still give her oxygen for her comfy as well. For the family's part of the comfort treatment, that there is an open hour. You need to, as far as you want to stay with her, you can. And also you ask about the, if she has any wishes, if she has any advance directive before, or she nominate anyone to have a decision if she had the reach this time of her life. So explore first if she has previous wishes. Sometimes patients, if you ask me, I will tell you, she's always saying she wants to die on her village. So we can facilitate that to discharge her from the hospital to her village with fast track her to that area. And you tell the family if she has any faith and if she need any like make him what do you call? So if she's faith on anything and she needs someone to be on her last minute to be with her, we offer that. We offer psychological support to the family by the abbreviation team, and then we because this patient till now she have no DNCPR. So you mentioned this like at the end that obviously if her heart is stopped, will not try to restart it. That means we put what we call a DNCPR. That means we will not jump on her chest if this has happened. So this is your task. The main task is the end of life care, not the medication has been given. So I think you just spend a lot of time to explain. You explain it very well, explain what has been done, and even you spend a lot of time in saying that she is not for ICU. So because she is not for ICU and we didn't give her this treatment, we can go briefly on that part. And if you explore the daughter, what do you think your mother, if she reached this stage of her life, is it how she need to be treated? We think that to make her comfy at this time, and as far as the treatment is not doing anything, we think fair on her to make her at least comfy and peaceful. So this is the end of life care plan. Okay.
Yes, Dr. Maida, because I built a scenario in my brain that you will tell me why not admit in the ICU. So I wanted to be priority to tell you that yes.
You can tell just.
But it is surprise to accept.
No, accept because
surprise.
it's trial anyway, and most of the people they didn't like the intubation. It's harmful for them. The intubation is not an easy procedure, and most of the people don't like it.
Yes.
Yeah. Thank you, Dr. Maeda. Any other comment?
So I forget. So you have to talk also about express any wishes or
Yes.
advance directive or
Definitely.
So
Definitely.
Yes.
this is the scenario mainly.
Yes.
Exactly. Yes.
End of life care. Yes, sure.
Definitely. Okay. Thank you, Dr. Maeda, for the scenario and comment. Let me start for 3 essential points you have to discuss, Dr. Mahmoud, here, and you didn't do.
Yes.
What do you think?
Yes.
What I will say?
اللي هو الفيوتشر بلان اللي هو ادفانس دايركتيف لاست بار اوف اتوني
Okay, this is at the end. What
at
about
the
the
end.
introduction? So 1 point at the introduction, 1 point in the middle, 1 point at the end. And the other cornerstone of this scenario.
At the introduction I tell here are you the next of kin
Okay.
and the expectation
And
uh,
the dying patient, what you should do.
Yes, yes. Do you want to attend? Yes, Dr.
you
Bass.
have. It's not
Yes.
only a question, it's encourage.
Mm,
You have to encourage for attending someone here to be supporting here. You are going to break bad news, not only bad, it's very bad news. She cried all the scenario because of you. You didn't
mm,
give her some support from the start.
mm,
No one attend to sit with her, to support her, and to give her and to hand her the water and tissue. You are the one now giving her the water and tissue.
yes.
Okay, so she need a lot of support from the start. Please, this is the take-home message from this scenario. Any end-of-life care, and it's very common scenario nowadays. End-of-life care scenario at the beginning, introduce yourself and ask someone to bring to attend, but invite and encourage for that. If you need someone to attend, please let him come. Your brother, your sister, whosoever, anyone will attend. He will help her. Okay, so it's
Mhm.
something to be encouraged for. This is the first point. The second point, which is the task, and I
Breaking bad
think
news?
yes, of course, breaking bad news you have to do. I
I
think you
didn't
did.
do.
You didn't do.
No, I didn't
So
do.
yeah, so the
But
breaking bad news here. By the way, the second point will be the breaking bad news and the task. You didn't say it at all. All the scenario you didn't say or state that this is end of life care. You didn't say it, although it's your task. Imagine
but what I
you
will tell
didn't.
Dr.
Yeah,
Basim,
yes, our team
yeah,
decided in the best interest of her condition to give her what we call end
yeah.
of life care. This is the breaking bad news and the same time the task. Have you ever heard
Mm,
about it? Oh my
mm,
God, doctor. It seemed that, or it sound that you are going to leave my mom or let my mom die. Give her some time to react because already you break the bad news. It's very bad news. We are already letting her die, and we are also applying what we call end of life care. I'm so sorry. Take water, take tissue, whatever. Then continue explaining the end of life care. So you will start the scenario by the from downward upward. You started no the opposite. You ask her about the condition, and we admitted her to ICU. We couldn't put a CPAP, and she is losing the consciousness. Yes, you are trying to prepare the patient, the surrogate, but you
mhm.
lost the other parts, the end of
Yes.
life care. You didn't talk about end of life care. What about the end of life care? As Dr. Maida mentioned, so we will stop everything. Even the CPAP machine is already removed. By the way, there is no CPAP.
Mm,
You will just put oxygen mask and some painkiller to keep her pain free, and some of the blood fluid or some fluid through the blood channel. Nothing per mouth. Nothing also will be antibiotics. No more support as vitamins or some medication. No antibiotics, as I said. So this is the issue, and this is the task. End of life care means you are withdrawing everything, keeping patient on painkiller, some IV fluid, and oxygen. Full stop. Will she die, doctor? You didn't answer this question, and you said all of us are dying. No, you have to say yes. I'm so sorry. I'm afraid to say, sadly, yes. It's a matter of hours, even minutes. Okay, this is a matter of hours or minutes. Once you will do so, the patient will die. You remove the oxygen. You put the oxygen, yes, but you didn't give the CPAP or the pressure that the patient will breathe through. So she will die within minutes up to hours. This is the matter of the point or the idea of end of life care. It's a matter of minutes, hours, maximum days. Some patients they can survive longer, but they will not exceed days. Okay, so this is the difference between also palliative care who can live longer, maybe hours. Sorry, maybe uh, years or even months. But in our scenario, no. In the end of life care, in the mean, you already give her that the ticket to go out of the life.
mhm.
So you have to mention that, and Let her react whatever she will do, but this is our truth. The patient will die. The next thing, as Dr. Maida said, what about the wishes? What do you think your mother wished previously or in the past? Did she nominate or ask someone to take decision on behalf of her? Did she documented any wishes in the court, which is advance directive? Yes, doctor. She want or she wished to die at her village, as Dr. Maida said. Yes, we respect this wish, and we will arrange for fast track discharge to help her to be in between her beloved person, her family, and we will facilitate that, respecting her wish. Okay, even she will die, no problem. Other point to be raised here, the nomination already you asked about anyone to take decision, and of course, if she has wish, you have to respect it, whatever the situation and whatever will happen. Even she will die, no worry, you can follow it. Okay, let's go back to the comment of concern. What is the next step? Yes, she asked the next step because you are giving her a lot of explanation of the previous management which already failed.
Mm.
So she's waiting for, she's the one asking you, give me the last step of this. What's your next plan? So the next step will, you can say it frankly, we decided in the best interest of her condition about end of life care. Okay, see, even she's asking you, she's helping you to say it. Any solution, if or other option, I'm so sorry. Your mother being frail, she is having a lot of failure in her system and her organs, and she will not respond to anything. And here, even the awareness is lost. So she is deteriorating, and I'm so sorry to say that. Do you think she is going to die? Yes. You have to clear answer here. Yes. I'm so sorry. Afraid to say. Sadly, I appreciate your worry. I know she's so much precious. Whatever you want to say, but you have to say yes, she is going to die. And don't tell her all of us will die and this because they are not believing on this, as you know.
Mm. Mhm.
Okay, she is my family. Yes, I can see from your reaction that she is everything for you. She is the main. She is the home support. She is the one supporting you emotionally. Yes, everything. But I'm so sorry to say that I'm afraid about saying that she is going to die. Again, the last. Yeah, is there any hope? Again, another clear answer. I'm so sorry, afraid to say, sadly, there is no hope. I don't want her to suffer from any pain. See, now she is helping you in your medical decision. Yes, of course, this is our aim now to help her and to maintain her dignity and to die in peace. And she will not, we'll be sure that she will not feel any pain in her coming hours or minutes by our pain doctor or pain management team. Want to sit with her? Definitely, this is your right. Even we can extend the visiting time for you, particularly, and for your family members to come and to sit with her at her last moment or at her last hours or minutes or whatever. Okay, this is how to answer every concern related to end of life care. Be honest, frankly talking. Don't deviate from the plan. Don't say no. We will try. It's support. No support. Even here, you are withdrawing the support. We will support the family now, spiritual, social, and religious. As I said, spiritual even bereavement team, you can invite here the bereavement team, the team who's sitting with the family and support them emotionally and so on. Okay, so the support already withdraw from the patient and will be given to the daughter and the family, not only the daughter. You can even invite her or encourage her to call her brother and her sisters to come and say here to see her before she will die. Okay, this is in conclusion about the end of life care scenario. Again, it's lucky scenario to have it. Nothing tricky in this scenario. Task you have to do, message you have to deliver, and some wishes you have to ask about and say thank you, goodbye. Clear? Try to do this scenario again, Dr. Mahmoud.
Yes.
Or Dr. Ala or
today.
anyone. Yeah.
Okay, so Dr. Basim, we will tell the surrogate that the plan now is to shift here to end of life care.
Yes.
That
And this is what's written.
Mm.
They wrote for you deteriorated. Even CPAP they removed.
Like palliative, like that. Okay.
No. Palliative is different. Palliative still you are giving care and you are supporting. You are giving medication, antibiotics. Palliative is longer than the end
Yes,
of life.
I know that palliative, but I will tell end of life. That is
Exactly.
So
Yes.
the end of life also managed by palliative team. So
Yes.
the palliative team will be there because they give support to the family, and they at the same time they prescribe their medications, the pain medication, secretion for the secretion. They prescribe even the fluids, not the fluid. I mean the oxygen. So the palliative team they have a list of medication they are given to support. I mean to make sure that the patient is comfy, and so it's still the palliative team will be involved.
okay. And what about the nutrition?
The nutrition according to the patient, if she can eat. But
No.
obviously, our patient is not. She can eat. Normally, even the fluid we stop. Any invasive procedure and no pain. That means even the medication they are given through the subcutaneous. They give subcutaneously.
Yes.
Remove the cannula, remove everything. Just
Yes. Exactly. Even the eye fluid, if she insists, doctor, please, she will not eat anything. You can say we can give her some fluid, but it will not change the outcome.
Yes.
So, but don't say, yeah, we can give her some food through her mouth, what she wish. No, you can give in the palliative therapy. Some patient, the cancer is already affecting the swallowing. So you can give some sip according to his need and according to his wishes. For example, the patient asked to eat something he can do swallow. Okay, we can give him like sip or trying to give him to swallow. However, if it will harm him, we will not let him take again by his mouth. But I remember this scenario. It was the second scenario for me. Anyone discuss or give option of NGT or something to be given through the mouth, they minus him. What I mentioned in this scenario, I mentioned the eye fluids, and hopefully the comment was good. Okay, so no one comment on the eye fluid, but all candidates spoke about NGT feeding or will give her fluid through, give her food through the mouth. All of them, they minus them. So
What is the
basically,
case, Dr. Basim? Sorry.
it was ICH, massive ICH, and they asked me to talk about end of life care. So whatever the pathology or pathophysiology, it was the same task, end of life care. So we are talking about comatose patient who cannot eat, who cannot even he's not conscious. The GCS they wrote like that. GCS deteriorate from 11 to I think 3 out of 15. So no more conscious level comatose patient. Talk to the daughter about end of life care, and they ask the same concern and the same question: how many days, what time he will die? So you can tell a matter of minutes up to hours maximum. Okay, because in the same scenario, not only ICH, they said the patient aspirated. There is frequent aspiration with evidence of pneumonia in the chest X-ray. So how you can feed the patient? Okay, patient comatose. Even the NGT will not help him because he's comatose and the conscious level is severely impaired, comatose 3 out of 15, and he's going to die. This is what was written in the task, end of life. So you have to speak about what I already mentioned earlier. Okay.
And about the nutrition, give him fluid
Or-
by blood channel.
yes, yeah, exactly, yes. And anyone said NGT or feed him through the mouth, they minus him.
Okay, Dr. Bassem.
because there is evidence of aspiration.
Mhm. Okay.
Okay.
Sorry, Dr. Bassem, what will be the introduction? And I will tell here I have not good news for you.
Yeah, I don't
Uh,
have good news for you.
And then what is the not good news?
Yeah, I don't have
She,
good news for you, or I have bad news for you.
okay.
What you will say more than the patient will die. So no need to be gentle with her. Be
Mm.
honest and frankly talking. This is your task. It's breaking very bad news. Patient will die. End of life care. They will accept by anyway. The patient will
Mm.
die. Even if you finish this meeting, she might be die.
Yes.
So,
So I
why
will
you
tell
are
here
telling? Yeah.
your mother deteriorated and
Yes, exactly. I don't have good news for you
mm.
today. I'm so sorry to say that. Oh, doctor, what happened? Is she fine? What happened to her? Yes, I appreciate your worry. I will tell you now. If you let me explain, I will tell you. Doctor, please tell me what happened. I'm so sorry. I'm afraid to say your mother condition deteriorated, and in the best interest of her condition, our team and our doctors decided for what's called end of life care. This is the main task. From the
Yes.
first
Mm.
moment, you
Mm.
have to say it. Then explain the end of life care. Then explain the situation because of her condition deteriorated. The conscious level is not improving. We tried what's called CPAP. However, she didn't respond because of she is frail, elderly, having a lot of infection before. So to maintain her dignity and as she is tired now and she suffer a lot, we cannot give her a lot of support. Now the time to withdraw, and unfortunately, the team already decided not to even to do a heart massage whenever the heart stops. No one can jump to do the heart massage. This is included, by the way. Okay, because she might ask you why you will not give her this massage. So definitely we will not do it. Why? Because we are maintaining the dignity. Let her die in peace. By the way, I said this word. Let your father die in peace. She was angry, surrogate, but she should accept. I said it frankly. So that let your father die in peace. So you can say it. Let no one commented about it, by the way. So do it and do it. Use your tone. By the way, you have to use your tone as sympathy and empathy way. Okay. Always, whenever you are going to do so, make your tone very less. Whenever she is shouting, yeah, try to absorb that, and also make your tone lower than the normal tone for you are talking about the whole scenario. Okay.
Mhm.
Yeah, this is the way. And the advanced directive, of course, you have to do it at the end.
Yes. Thank you, Dr. Bassem. Thank you, Dr. Naid.
Most
Very good.
welcome. Thank you, Dr. Mahmoud. Well done. Anyone want to comment? Because there is good question here. Yeah, Dr. Henry started this topic. Do we need to mention about organ donation? Never ever talk about organ donation in elderly, frail person who's dying and he has multi-organ failure. The only patient candidate for organ donation will be young, healthy one, has a trauma or has a coma due to something in the brain, and his brain gone, which is called brain stem or brain stem death or brain clinically brain death patient due to brain stem loss of brain stem reflex, means that the breathing, the circulation, all everything, the centers of these vital organs already lost or gone. So what the organ is doing now, due to some support from external like vasopressor, like ventilator, whenever you stop the ventilator, the patient will die. Whenever you stop the vasopressor, the heart will stop. Those patients with healthy other organs, they can be candidate for organ donation. So don't speak, and it will be clear scenario. Patient has coma, intracranial hemorrhage, or even trauma. After trauma, he had severe head injury and so on. And the other organs definitely will be fine. Not as this scenario, frail patient. Okay, other question. In which condition we can speak? Yes, I already mentioned brain stem death or clinically brain death. It will be mentioned in the scenario. Some scenario they write for you talk about organ donation. Some other scenarios will be as hidden agenda. It will be after discussing the patient condition, and it will be hidden agenda. As I said, it will be one of the young patient, boy has an accident, or young guy who has ICH, and now that you are talking to the father or to the son, what you will do, doctor? So you can raise the issue of organ donation, not in details. There is a possibility to be a process called organ donation, and try to make it in a good way. If your father is living now, he will donate or he will help others, right? Yes, he is helping others. So based on that, he can help other people who is suffering from organ damage. In order to help them, we can do so regarding by taking his organs to those patients. He will help them to survive longer, to not to suffer more, and he will get the reward from that by doing this. This is the way. Then you can say it's an organ donation committee, and they will sit with you again and your family to talk about this process. That's it. So you have to raise it, but not in details. Dr. Maida, last comment. If the patient admit to ICU die on ventilator, what about this? What you mean, Dr. Maida?
I think the indication of organ donation. I
No,
think.
not
No,
only.
if the patient in ventilator, that means he's healthy in the first place. That's why we put him in the ventilator, so can donate. I'm just
No,
replying
not-
for that question.
Yeah, but not only the ventilator. So not every ventilated patient will donate. He should have other organs, healthy organs, and he has also brain is gone. His brain is gone because you cannot take from patient semi-comatose his organs while he's still living, even in coma. He should be not only coma, he should be in a condition which is called clinically brain death. And there is test to be done to confirm this. EEG and CT, angio, apnea test, all these things should be done to confirm this patient brain is already gone or dead. Okay? Yeah, he should be on ventilator, but he should be also with clinically brain death. Clear for all? Dr. Mahmoud and Dr. Maida?
Yes, very clear, Dr. Basil. Thank you very much, really. And thank you, Dr. Mayed.
Yeah.
Thank you very
Yeah,
much.
it's nice session really with two good scenarios. Debateful one, but the second one I think clear, and it's lucky scenario if you have it. Believe me, Dr. Mahmoud, you can get good mark whenever you do this scenario, because the scenario, the task is clear. The circuit might be little bit angry, but you can convince with some support, spiritual. Call someone to sit with you. With your talk, you can convince her. But still, this is the truth, and you have to do it. Don't deviate from the task. Don't say anything. Don't give any hope. Yes, hours. Yes, it's hours. Minutes, if written in the scenario minutes, you have to say minutes. Don't give her some hope by saying, okay, might be longer. No, it's not longer. She will die within minutes, maximum hours. This is the end of life care. Always, they are not surviving longer. Okay, I will give chance to anyone to comment. Anyone want to add any comment or to ask even? Is it clear for all, or the others or the all are sleeping? Either this or that.
No,
Either it's
clear.
clear for all.
Clear,
Yeah.
clear. Thank you
Okay.
very much.
Alhamdulillah. Okay. Hopefully you get the benefit from this session. Really, it's one of the good sessions since we discussed these paracetamol as a first scenario, first time, and the end of life care in details. We will add it to the collection of our end of life care. We did a lot of end of life care scenarios. If anyone interested to know more, he can listen to the other records, and he will know and he will confirm our talk. We didn't change at all our plan regarding end of life care. It's clear, straightforward scenario. You can gain good mark in it. Good luck for everyone. Thank you, Dr. Maida and Dr. Mahmoud. See you tomorrow, inshallah, with short clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
عليكم السلام ورحمة الله.